I am Felix Kimaru, the founder of Totohealth. So Totohealth was founded in 2014, March of 2014. We've grown from an idea stage. So Totohealth is something new, so it never been built before. We didn't have a neighbor to be looking at the business model from. So we've grown to 65,000 active subscribers, 39,000 in Kenya, and 35,000 in Tanzania. We expanded to Tanzania in 2016. We have a team here in Nairobi and also in Tanzania. So that's briefly about us. So today, mostly I wanted to speak about my journey and Totohealth journey, mostly from an idea stage, how we got to where we are. I'm not saying we've succeeded. There's still a long way to go. But I think the lessons we've learned through the journey are going to be beneficial to someone. And even not just the entrepreneurs, but also the stakeholders themselves. So I was born in a village called Kaptinga village in Eldoret, about 8 kilometers from Eldoret town. I went to a local primary school called Kaptinga. No one of you knows about it. Then I went to a high school called Paul Boyd. No one of you knows about it as well. So after that, I managed to get an opportunity to go to Maseno University. And I wasn't self-sponsored. I was sponsored by the government money, which is what we call HELP. So I studied computer science in campus. And so essentially, my entrepreneurs all along didn't ever anticipate that I would be an entrepreneur. I knew that I would work as a computer science. I would study computer science, do a master's in something related to tech, do a PhD in something related to tech as well, and work for a big multinational and earn some good money. So while I was in my third year, I applied for an internship in an organization called Ashoka. So Ashoka is a global organization. They support social entrepreneurs. And my work there was to work with the social entrepreneurs who they support. So some of the social entrepreneurs they support, like the founder of Jamii Bora Bank, if you guys know them. We have a guy called David Kuria who started the eco toilets. You see the public toilets in town. So traditionally, previously, toilets were just toilets. Nowadays, you even see them selling KDF by the sides of the toilets. That's David Kuria. Change the narrative around the public toilets. So there's also another guy called Aaron Washira, who's built amazing stuff. There's a guy in Tanzania who's built a company called Apopo. They use rats to detect TB and landmines. So, having exposure to such individuals really inspired me. So when I was in third year, so I had not finished school. So when I went back to campus, I continued working for Ashoka part-time. But after my academics, which was my fourth year, I thought that because I studied computer science, I didn't study working with other entrepreneurs, supporting them connect. So I said, let me quit Ashoka, work as a developer. So I quit Ashoka, worked for some other company called Elective Africa as a developer. So I was a web developer. So I worked there for 6 months, then realized that I think a lot of inspiration coming from Ashoka, the guys I was working with, I realized that my passion had shifted. Not being employed, I needed to start something of my own. But then, the reality is after campus, you guys know, you're broke, help wants you to pay back their loans. Your parents expect you that you need to have a job, you need to be paying for your siblings' school fees. So my venture and what I had in mind was something fully profitable, nothing social impact, something that would make me money, something that would build a good house for me, make me buy land in Nairobi, stuff like that. So I registered a company called Nadcon in February. That was February 2013. Worked alone. I didn't have someone to work with because I couldn't pay salary. So I used to develop websites for guys. I could get one guy who wants an application. I would build that. And my aim was to grow slowly to start getting the big projects. Then I realized that it was really difficult for someone to contract an individual and pay you 500,000. So it was then, I was getting jobs 40,000, 50,000. If it goes so much, 100,000. which was somehow good, but I was working from my place. So I said I need to move on to the next step. So there were guys I was in campus. They were also thinking of the same thing as me. So we joined us as 6 guys. We built a company called MobiDev. Some of you might be knowing it. It's a software development company. Essentially what I was doing for NADCON, we became a team of 6 co-founders. That I know the changes with a huge number of co-founders. Yes, so 6 co-founders, the same shareholding, no one above any other person. So we did that for about 6 months. So fortunate enough, so it was growing. I mean, we worked with a couple of, and I know some of you here we built applications for. We got the first job for 500,000, so that was exciting. But then you see it's 6 guys, 500,000. When you split it, it comes to about 8,000. Took us 3 months to build the system. So if you calculate downwards, we were earning about 30,000 per month. So it didn't really help, but at least it was progress. I mean, we could see that there was progress in it. So a sad thing happened in 2013, in December. I lost my auntie, and my auntie was pregnant. I mean, from the village. It wasn't actually our first child, it was her 3rd child. And what happened is, I mean, we have the traditional birth, and I know most of you, you know someone who's passed on during birth, friend of yours, or a relative, or a neighbor who's passed on delivering or during pregnancy. We hear a lot of those stories, but then usually it doesn't touch us until it comes back home. So when it happened to my auntie, I was like, okay, finally this thing is in our family. So she was pregnant at home. She thought that she had never gone to clinic. She thought she didn't know that information. So she thought she would deliver she would deliver just as the other kids, using the village midwife. So the sad thing that happened is she didn't know that she had twins. So when that time came, when she had labor, she went to they called the midwife to come, and in the process, the midwife said that it was a complicated birth and she can't be able to handle it, that she needs to be taken to Moi Teaching and Referral Hospital in Eldoret. So by the time all the process of getting a vehicle, she passed on. So unfortunately, we lost my auntie. We also lost the 2 kids, which was really sad to me. So when I came to Nairobi, and for a long time, I didn't used to speak about this story because in our community as men, you're not supposed to speak about those things. So the initial guys who heard about Totohealth story didn't have that part. But that's where the inspiration for starting Totohealth started from. So when I came to Nairobi, I was just thinking, yes, we built really good solutions for guys. Is there something that can be done, I mean, so that we don't lose parents? For my auntie, it was as simple as her just, I didn't even want her to be educated about delivering in a health facility. I just wanted her to be educated about going to clinic, as simple as that, because I know the doctor would do the rest. Tell her why it was important for her to deliver in a health facility. Probably the doctor would have even known in advance that she had twins, so that she prepares. So when I came to Nairobi, so I started researching. It was now becoming something of interest. And having my background in Ashoka, so I had an aspect of, you can actually run something as a business, but at the same time have a social impact. So I did my research, looked at the statistics in the country, and it was really bad. It was even beyond zero, which I know majority of you know, as a country we are doing bad in terms of maternal and child health because of beyond zero. It was even before that. So I did my research, looked at Mandera County doing really bad. Mandera County are recording the highest deaths ever in the whole world. And you see, it's sad that we hold that statistic as a country. We are bright individuals. We have innovative solutions for our problems. But then there are aspects that are still holding us as a country. So just to give you a background, in Finland, they lose 2 mothers in every 100,000 births. 2 mothers. In Kenya, we lose 455 in every 100,000 births. So I think the challenge is, should we hold that statistic? I think we are bright individuals, right? So we should not be holding those statistics. So I sat down with one of my co-founders of MobiDev. I told him, I think this is something that we can do. Can we build a simple service? Because we have computer science background. Can we build a simple service that would remind parents to go to their health facility? So and the question was, how do we do it? How do we reach parents in remote areas? Because those are the people who will need it. So eventually what we did, we designed Totohealth to be an SMS-based service that would advise parents from pregnancy and way until their children are 5 years old. So the messages themselves, for them to be relevant, we didn't want to just blast guys. So we said, let's build an intelligent system that based on what stage they are in their pregnancy, they would receive messages that are relevant. And if they have a child as well, messages that are relevant. So, but then how do you know which stage they are in during pregnancy? So we looked at two things. So number one is, usually some mothers who've gone to the health facility, they know when they are going to deliver. Then there are so many in the country who don't know when they are going to deliver. In Turkana, they use the moon. They don't even know the month. So, so we told ourselves, number one, we don't want to build something that will be used by 50 mothers. Let's build something that will be used by all mothers in Kenya. So it needs to be something usable. Doesn't need any training from the end user. So we went back, we said, I think all mothers know when they last missed their period. So we use that information. So during registration, we collect that information. Our system is able to calculate and know which stage you are in pregnancy, give you the information that you need every Monday and every Thursday. Every Monday at 9 a.m., every Thursday at 9 a.m. We've done tests to know which days of the week people read messages, what time of the day people read messages, and those are the processes that we used. The messages are 140 characters each. Messages are translated to local languages. So if you don't understand English, you receive in Kiswahili. Over time, that is last year, we launched our voice service so that if you don't know how to read, if you don't understand Kiswahili, you receive messages in your local languages. And we've done Somali, we've done Turkana, we've done Luo. So parents, instead of a text message on Monday at 9 a.m. or Thursday 9 a.m., you receive a phone call. And we've done really interesting stuff. If you miss the call, unfortunately, you can call back and you will hear the same message. So really works beautifully. So after birth, we also do the same, but the one for children is easy. Based on the date of birth, we can know how old your child is. So the system grows. So it's customized to every parent. We have names of children. In fact, some parents even think that there's someone on the other end texting individually. So the system has worked. I mean, it's taken us a lot of time. I think on the story of content, because that's the system side. On the content side, because we are not medical professionals, my co-founder was also a techie. And I'm glad to see Fred, you can see. So Fred is here. So Fred is the person who connected me to my first medical person. So he was a friend of mine. So I was going to visit him. And I told him I'm building this. He's an Ashoka fellow. Fred is an Ashoka fellow. So I told him I have a tech background. I'm building something in health. I don't have content. I told him the only thing I have. So there's a time I went to Nairobi University. They had this chart on the wall that they had said, in 1 month your child should be doing this, 2 months your child should be doing this. We took that, we converted them to messages. That's what we were sending out. So, but then you see it was very few. Them there was monthly. So in 12 months they only have like 12 messages. So I spoke to Fred, and Fred told me, I have a volunteer from VSO who works with me, but doesn't have a lot of work. You can talk to her. If she agrees, she will work with you. So I went to the office, met Fonda. Fonda eventually became one of the directors of Totohealth. She worked as a volunteer for the first 6 months, which, I mean, it was amazing. She built our content. She did a lot of research. She even got our content approved by the Ministry of Health and all that. So that's the journey in terms of the product and all that. But I think today I wanted to focus more because what we've done a lot is hustling in terms of raising money, hustling in terms of partnerships, so which I think would be really key for guys here. So when we started off, when we launched Totohealth, it was, and we were part of iHub like from the beginning. MobiDev was based in iHub. So there was a program in MLab called Mobile Impact Ventures. It was run by MLab, which was a subsidiary of iHub. Don't know whether it's still there. I think it's no longer there when iHub moved here. So the program itself, they were giving out $5,000 to 2 startups. But at the end of the program, who've shown the most progress? So 2 startups from idea stage to most progress. So that's how we raised our first money. So we went through the program, worked really hard. In the end, unfortunately, we didn't win the competition. So the judges who were brought in said we had grown too much. The money wouldn't be enough for us. So I remember that day I was really dejected. I was staying in Jamhuri. So I went to Jamhuri. John Kieti was the one running MLab. So I told John Kieti, yeah, let me tell you, to be very honest, we were working hard knowing that that money is there. Without that money, we are not going anywhere. This thing is just going to die. So fortunate enough, they had discussions internally. They decided to fund us. So they gave us $5,000. They also gave us a space, so an incubation space. So we worked from MLab for that time. So we used the money I started bringing in some volunteers from Strathmore University who could work with us, registering parents from the health facility. But then the money, $5,000 was very little. I wasn't paying myself then. I was still paying myself from the Mobidev side. But then we needed to have a team that was cool, because I was really passionate. I was really passionate about it. I couldn't hear anything. I remember there are guys who told me this doesn't work, because someone else has done it. But I can't even remember who said it, because it didn't really matter. So in November, we did a crowdfunding campaign. And it's because we didn't have money. So we'd say, let's do a crowdfunding campaign. And you guys know what crowdfunding is, right? You get your friends to contribute to you through some platform. So we did a crowdfunding campaign, which we thought was going to be really easy. But it became really hard. So eventually we raised $15,000. And during that time, we got an opportunity to go to Finland with one of my colleagues. And we thought that in Finland, guys have money. We will just ask one guy to put money, and they will give us money. So there's a guy we met. He was driving in Finland. And we thought that this is the guy who will give us like $1,000 or $2,000. So we told him, this is the link. You can go contribute here. You don't want to borrow money. If you are doing, sometimes when you're doing crowdfunding, you want to direct people to contribute through the platform. So we sent him the link. In the evening, we saw he contributed $50. So he was like, okay, so this is going to be difficult. So fortunate enough, we pushed it. In 2 months, we managed to raise the $15,000. So that gave us an opportunity. That at least gave us some money to go with. So I started speaking to investors, spoke to Novastar, spoke to Savannah Fund, who Eric Asman was one of the founders there. The feedback wasn't that interesting. So they told me that they can't fund me because we didn't have any revenues, we didn't have a business model then. We were still 3 guys. So that, I closed there. We realized it was hard to raise from investors. The story going around was there, you raise from investors. But we realized it was really hard to raise from investors. So we sat down, we brainstormed as a team, we were like, how do we raise money? We need money. And unfortunately, startups need money. You need money to hire a good team. We knew we needed some people in the team. How do we get money to do that? And we told ourselves, we have an amazing product. If we tune it, we can win competitions that have money. And some of you guys saw Totohealth in every competition in 2015, 2016, not because we liked competition. We were actually raising money. So we used that as an opportunity to raise money. We failed in a lot of competitions, but in some of them came money. Some of the awards came with money. One of the keynote speakers in the afternoon we were with in London, we won $15,000. We went to an incubation space in 88 MPH for 3 months, but we knew that comes with $15,000, which was extra capital for us. We joined programs that supports entrepreneurs like Spark, which I was with her, which eventually got them interested, and they invested $50,000 in us. So there was another program also called Spring Accelerator that was managed by Palladium Group that we applied. It was for girls. And sometimes the thing is, not every not every program fits to exactly what you want. You have to tune it to what they want. So that's what we used to do. We see this program, we tune our service to be for girls. This other one for fathers, we tune our service to be for fathers. So we tuned our service to be for adolescent girls, and we joined the program. So that came with $80,000. Yeah, so that was a huge one. The highest money we had gotten. So we managed to get in. But then that is when we started running as a business. Before the money, they sent KPMG to audit us. We are still a small startup. In fact, that guy who was sent, I was just telling him, do you understand that we are a startup? Like, no, we don't care. Your company registered as a limited liability company, right? So we will audit everything. So we sat down, we told him, so we sat down with our accountant. Fortunate enough, they sent us the list of things they were going to check prior. So they had 7 items, right from governance, things we never talk about in startups, governance. We had never even thought about. Yes, I know I was the founder, but there was nothing like even an organization structure. I mean, you could meet me anywhere. There was no approval levels and stuff. So they sent us the list of items. They even told us they need an asset registry. It's like, what is that? So they told us they need, there was something else that was really funny. So I told them, the thing is, just understand that you're coming to audit a startup. You'll probably finish all this work in 2 hours. They had given us, they had said they are coming for 3 days. And that was before the $80,000. So I told them, so what happened? So I told our accountant, let's make sure we have everything in place. You tell me, you've worked elsewhere. What are the things they need? So we started making documents and stuff. So we hacked it. We hustled our way through. They gave us a 3 out of 5, which wasn't bad, but we passed. So they gave us. So they gave us the money. Then came the reporting, which was really difficult, which we really struggled through, because they didn't tell us the things they will need to collect. They didn't even tell us they will collect the receipts. So after that time, there's a guy who went to town, didn't pick a receipt, because the Matatu doesn't give out receipts. These guys are asking for receipts. So that process. So that is the journey we went through. We managed to eventually raise some good money here in Kenya. By the time we were expanding into Tanzania, which we made the decision in 2016, we had a bit of feel about how things need to run, how a proper company needs to run. And I know that's what you focus on. So we expanded to Tanzania. We applied for a grant with DFID. Together with our partners in Tanzania. We managed to raise 400,000 pounds for Tanzania. That was in 2016. The project is running for 3 years. So then we started speaking to investors. So this money has really enabled us to test out our business model over time, which we didn't have. So right now our users pay $2, which is 200 shillings every year to use our service, which is really affordable to most parents, and they pay that using M-Pesa. So we've structured partnerships. The money has also enabled us. And I keep saying the money has enabled us because startups need capital. So the money has enabled us to partner with counties. So we have partnership with 5 counties in Kenya. We recently applied for a joint proposal to World Bank with Baringo County, which we managed to get funded. So we are starting to realize revenue. So, and you realize that at this stage where we are speaking right now, we have revenues and investors can listen to us even more. So we have 2 investors who've put in money with expecting returns. And the reason why that is a key milestone to us is because initially, the only funding we could get was from capital, was from grants and competitions. So yes, 80% of our money still comes from grants. We still apply for proposals to Grand Channel US Canada, to DFID, to Bill and Melinda Gates Foundation, because we share a vision. So as I wind up, I think key things, partnerships also what has really enabled us to work with county governments. Initially when we went to the county governments, we pitched how awesome Totohealth was, and we failed a lot. So we eventually realized that the county government doesn't really need to hear how awesome your product is. And even the government, they want to, in fact, they don't even want to try something new. They want something that has been tested severally before. So what we did with the county governments, we decided to align ourselves to their goals. So Totohealth, for example, out of use of Totohealth, life improves. And in what areas does it improve? So we looked at those things that Totohealth improves. When we go to the county, we tell them you are here right now, but by use of Totohealth, you will be here. One of the good examples is, we do encourage parents to deliver in a health facility, which is what my auntie died from. So 62% of Kenyan parents deliver in a health facility, which means there's a whole 38% who deliver at home. So out of use of Totohealth, and we've tested this, 92% of them deliver in a health facility. So what we go to the county, we tell them, You made sure that maternity is free, hoping that 100% of parents will deliver in a health facility. But there's another component of education that is missed out, and that's why it's stuck at 62%. So, and we promise them that by use of Totohealth, it moves from here to here. Majority of them will tell us to do a pilot, which is okay. So we do a pilot, after that they see the results, and we sign contracts with them. So it's really worked out beautifully. Partners like Safaricom have come in, they've funded us before. We are now signing a partnership with Safaricom as well to roll out to the whole country. We have partnership with World Vision, which is a big NGO that you would expect that they would really partner with a startup. And it's by showing them that the product we've built is awesome and it improves lives. So, and this way. So I think key things for me, key things that has really helped us through the journey, definitely what the other speakers have speaked about, but also what is key is networks. So I attend a lot of events. Almost 30% of my time I'm always in events, and the reason is because that's where you meet guys. You guys know GSMA. So GSMA invested $40,000 into Totohealth, and it's because of a guy I met in an event. So we started having a chat, which we didn't know that it would return to something, but the organization apparently had a fund that they would support startups like us. So we did a huge radio campaign with Ghetto Radio, with Radio Maisha, together with them. Cost that I know as startups is really hard to say you're advertising on radio. So I think key, yes, passion, all that, but also networks. And I mean, build your networks. If today there is a particular program that they need a referee, don't get a referee from your campus friend that you used to have a club in campus. You started a club in campus. They would want, you can't get $200,000 out of that, $200,000, right? So you need guys like Daktari to recommend you. So, but then how do you get that? So through events like this one, speak to guys, have their business cards, keep them, keep those conversations. So one of the tricks that I did, I used to add every guy as my friend on Facebook. So I would even meet, like the British High Commissioner is my friend on Facebook. So I used to do that a lot. And that really helped. And over time, I realized the things I post on Facebook, they see. So you don't post just anything. You can't go out drinking, then you post on your Facebook page. So I also on Instagram, I think our funders from Spark, who supported us before, they follow us on Instagram. So, and you use that as a way for you to do your PR, right? You attend an event like this, you take photos, you post there. Some of your friends will tell you, wewe unajifanya. But it's not kujifanya. I mean, it's an opportunity for you to show to people who funded you, your money is not going to waste. I also have a network. So I think that's what's key for me. We will have our panel session, which you can discuss more. Thanks, guys.